So there's a number of roles we can fulfill if we want to make the leap to become commissioners rather than just payers of services. We, as said already, we can coordinate care for the patient across multiple providers and geographies. We can assemble, analyze, and manage the total medical records of customers. We can challenge providers by monitoring results by medical condition across states and countries and providing benchmarks which are made public. And first and foremost, we can encourage preventive activity. That's one of the difficult parts, to get funding for the prevention rather than for the treatment. This is a challenge. Changing from being a payer to being a commissioner is a challenge for us. It's a challenge for the customer who doesn't see us as that. It's also a challenge in our own mind. How do we measure ourselves? We have to change our way of thinking from how much revenue do we make from our customers to how much we improve their health. We have to change our perception of how, we're thinking about how many customers we service to how many customers we actually heal, and from how we can reduce claim spend as an insurer to how we can reduce episodes of care, because again, that's where the real savings is. I'll just skip a little bit again of what was overlapping what was said earlier this day. As said in the beginning, I think the Chinese healthcare reform so far has produced some very impressive results. There's no doubt there's still a lot of work to be done, but the results so far has been really impressive. I was asked for recommendations for the Chinese, for China. I would say I'm not in a position to recommend. I think there's a lot of people in this room that know much better than me what is needed, where it's needed. The struggle is how to deliver it. What I would say is a patient-centered approach based on total health outcomes would definitely be a guiding principle. It's a guiding principle for us. And then more from a commercial insurance point of view, further opening up of both private healthcare provision and private health insurance, so we can build up proper integrated models like we see in other countries. In China would definitely be a help to create an alternative to the public system. Not that the public system is not good, but it frees up resources in the public system by removing those with the means to pay for private care out of that system. So that's what I will say now, and I'm happy to take questions later.